Very good morning. Today we discuss about the aging. Aging is the part of physiological and sports. So aging is basically starting for after 30. So aging is a process to gradually changes in the body with a process time, and these changes are noticeable usually after 30. Then after that is talking about the physiologically changes due to aging. So the research studies conducted in this field so that most of the system of or functions after reaching their peak start decreasing the gradually with age. Most of the research studies also shows that most of the organs seem to lose physiologically functions at about 1% a year beginning around 30 years of age. And there are various physiological changes which occur in our body due to the aging process. So one by one I'm going to discuss. First, discuss about the change in muscle size and strength. So when an individual get older, there is a decline in muscle size. The decreases in strength gradually occur during the age of 35 to 45 years. However, even at the age of 60, the decrease in strength does not appear to exist 20% of an individual maximum strength. So next one is change in metabolism and the body composition. With the advancements of age, our body needs less energy and the metabolism slow down. Consequently, there is an increase in the accumulation of the body fat, and therefore the lean body weight, bone, ligament, tissue, tendon, muscle, and water decreases. The change in bone density means that the elderly people, especially those who are 40 years old, they are more prone to bone injuries than young people. In fact, it is due to the decrease of various minerals such as calcium, phosphorus found in bone. Bone become less dense and more porous. Porous is a meaning of full of hole. The decreasing the process of these minerals begins in the elderly early 40s. Less bone density can result in osteoporosis and reductions of weight bearing capacity, which may lead to fracture. There can be reduction in height due to the thinning of vertebra. And then a change in respiratory system. The number of research studies show that pulmonary functions in impair with the advancing age. The airways and lungs tissues become less elastic. They become less efficient. There is a decreased oxygen uptake and oxygen exchange. The muscles of the rib cage become weak, hence the ability of breathe deeply is reduced, and pulmonary oxygen is reduced, which lead to decreased endurance with shortness of breath and fatigue. It can be said that the total volume, vital capacity, lungs capacity are decreased, whereas the residual volume is increased. The change in cardiovascular system, the stroke volume, cardiac output, and blood flow are all decreased with age. Blood vessels also lose their electricity. They become more and more rigid. Systolic blood pressure also increases in with age. The reduced blood flow result in reduced endurance. There is less nourishment to cell of body. Valves become less flexible. The next one is a change in nervous system. A change in nervous system. A number of research studies indicate that reactions time and movement time slow down with the increasing age. The brain's weight, the size of its network, and its blood flow decreasing with age. The next one is change in gastrointestinal system. With increasing age, there is a reduction in the production of hydrochloric acid, digestive enzymes, and saliva. These changes may result in delayed emptying stomach, impair swallowing, and then the liver become less efficient in metabolism drugs and impair damage liver cell. And the next one is the change in urinary system. This is a very vital point. So after 40 years that will be having having problem of people. As we grow old, the mass of the kidneys decreases. This lead to reduction in the rate of blood filtration by the kidney. The capacities of bladder decreases and there is an increase in residual urine. This change increase the chances of urinary infections. With increasing age, it can a long time of kidneys to get rid to waste product. These substances tend to remain in the body for longer period time. And the change in flexibility, the elasticity of tendon, ligament and joint capsules in decrease with aging. The elderly person lose 8 to 10 centimeter of lower back to hip flexibility. According to a research study, the range of movement is restricted as a age increases. Then next one, I'm talking about the changes in sense. Changes in sense with advancing age, the changes such as vision, hearing, taste and smell, touch etc may become less acute. Vision and hearing are most affected by the aging. The main changes in senses are elaborated below. Then change in vision. Visual impairment is the most common sensory problem of aging. In 40s, the people beings to decreased in size and in response to light. The lenses in the eyes become less flexible. The change in visions can affect the ability to drive safely. A retina become less efficient. The lens of the eye become yellow, more rigid and slightly cloudy. And the change in hearing, hearing loss is common with aging. The sense of balance weakness with aging. The older people may complain in dizziness and find it difficult to move quickly without losing their balance. And tinnitus, tinnitus as the meaning is ringing or booming sensations in one or both ear. Is more common among older peoples. So next one is changes in taste. Taste is also diminishes with age. In fact, the total number of taste bird are reduced with aging, and so the elderly people experience some decline in the ability of taste. It can cause loss of interest in food. And then change in smell. After the age of 50, the sense of smell decreases repeatedly. As a matter of fact, the number of functioning smell number of functioning smell receptor in the upper sinus decreases. Okay, in conclusion, in that it can be said that the number of physiological changes occur in our body as we grow old. These changes, including decreases in muscle size and strength, decreases in metabolic rate, decreases in lean body mass, increase in body fat percentage, decline in blood flow, decrease in stroke volume, decline in cardiac output, decrease in vital capacity, slower reactions and movement time, decrease in senses, etc. So this is for the physiological change of the body, human body after 40. So students, if you having any queries, you can ask now.